Hello everyone. In today's video, we are going to talk about artifacts. So if you have seen some type of artifact on the mammogram image, could you let me know in the comment box, let me know what type of artifact that you have seen. If you want to, you can also let me know how you went about correcting it. For the learning objectives for this video, we have identify artifacts seen on the mammogram images, discover ways to prevent artifacts from occurring on the mammogram image. So if you do not know what is an artifact is an unwanted structure or feature that is appearing on the mammogram image. Artifacts are not part of the breast tissue. And artifacts can obscure important anatomical details. It can mimic pathology or cancer. That's why it's important to review the mammogram images as you are taking them. Just scroll through the 2D, 3D images before the patient leave, especially since some patients, they drive far, maybe they have to work or maybe it took a long time for them to get in for this appointment. So it's always good to just check the mammogram image. And sometimes I find this helpful. Someone that I know, she used to be like a classmate of mine. Whenever I used to tell her about mammo, because both of us started in CT and then I went to mammo. So she would like give me advice. She would say, sometimes ask the radiologist to look at the images before the patient leave. So I think that's a good idea. If you are unsure of something, just go and check with the radiologist before the patient leave. And artifacts can degrade the image quality. As you can see on this picture above me, the white arrows point to like this line seen on the mammogram image. With this line, it's hard to tell if this is like an artery or a vein inside of the patient body, if it's regular breast tissue. So that's why it's important to recognize these artifacts on the image. An image misinterpretation, or incorrect diagnosis occur from artifacts. And also technical repeats. So whenever an artifact is seen on the mammogram image, and let's just say you didn't catch it, then whenever the radiology catches it, they are going to call the patient back. So that's considered a technical repeat because something happened from like a technologist point of view, or something happened due to machine failure. So that's considered a technical repeat. So we do have different types of artifacts seen in mammography. We have the artifacts that are caused by patients, which is motion artifacts. This is caused by patient movement during image acquisition, which results in blurriness on the images. I have seen a lot of patient motion artifacts, and this often occurs whenever patients aren't able to follow the breathing instructions properly. Sometimes they may move in between, or they may move before it's done, or so the good way to do this is you can always rehearse how you are going to give them breathing instructions, especially if it's their first mammogram, because some patients really don't know what to expect. They don't know how long they have to hold their breath. And then you can also just tell the patient, give the patient a heads up, even if they have had a mammogram. Let's say they've had a mammogram 20, 30 times and they know how it's going to go. Every tech is different. Whenever I train with different techs, one tech told the patient to hold their breath at the very end, and then I had techs who tell patients to hold their breath twice. So it all depends on how you was trained by different techs. And then we have skin folds. This is pretty common as well. The skin folds are overlapping skin. So as you can see on the image, the arrows pointing to one skin fold that is on like the outer quadrant of the breast, like your lateral side. The way I find this the best is I normally take like my finger and I kind of swoop that area, kind of like smooth it out. And you do not want to jeopardize patient tissue, breast tissue, whenever you are doing this, because you can jeopardize like tissue that should be on the mammogram image because you're trying to get rid of the skin fold. So what I find that works best is whenever I'm swooping it, I'm still holding my other hand taut on the breast and also compressing the breast tissue while I'm swooping out that tissue, or I throw in like an XCCL picture to help with that. And then as you can see, like the arrow is pointing down towards the medial aspect of the breast. Um, you can see like a skin fold right there. What I find helpful is you can raise up the detector on the machine, and whenever you raise up the detector, it puts it like right underneath that IMF, which can help get rid of the skin fold. So whenever you do have skin folds like this, it does make it hard to see or detect masses, cancer, or distinguish between what's normal, what's abnormal tissue in the breast. That's why it's important to look at the prior images from the previous year. If you see that the patient has had skin folds like 5 years in a row, you pretty much probably going to have skin folds for the 6th year, so just throw in an XCCL picture if you need to. Also, your deodorant. This can cause calcifications, or it can appear as if there's calcifications within the breast. So that's why it's important to have the patient to remove their deodorant. Sometimes the patient will say, I have on the clear deodorant, it's not going to show. And I always tell them, can we just go ahead and remove it? Because if it's shown on your mammogram, they may call you back. So that can powder or deodorant can appear as if there's calcifications in the breast. And then if a patient does get called back, now they're going to be worried if a cancer was seen, or worst case scenario, they have to get a biopsy now, pay extra money for a biopsy when it was just deodorant specks under their arm. You do have two types of breast calcification. You have your macro calcifications, which are the benign, the good kind of calcifications, that's no problem. And then you have micro calcifications, which sometimes can raise a suspicion for breast cancer. So that's why the micro calcifications are like biopsy, under stereotactic to make sure it's not an early sign of breast cancer. All right, so in this, you can see right here, these pictures are showing like different skin folds. So I'm going to tell you again how to fix it. You want to make sure that you smooth out the skin fold on the outer quadrant or the CC view with your finger, but do not jeopardize the good tissue to try to get the skin fold removed, because you want to make sure that you're getting a lot of breast tissue as possible. Also, if needed, like I was saying, make sure that you add an XCCL view. For your skin view on the medial, just raise the detector up. And then for your MLO view, have your patient bring like the what they call the bat wings right here. Have them bring it behind the detector, and then they hold on, and they'll bring their arm behind the detector, and it will help get rid of that skin fold at the top. Also, if the detector is too high where their shoulder is at, you can bring it down a little bit, because as you can see on the picture, like part of the bottom part of the breast where the IMF is at. On the third picture, closer to me, you can see that that's missing. So it's too much of the patient's arm in the picture as well. Okay, so now we have artifacts that is caused by patient devices. Make sure that you are documenting these type of problems or devices you can put. And I do have a video where I put how to document in mammo or breast ultrasound. So check out that video. If I remember, I'll try to link it in the at the end of the video or in the description box for you to find the video. But you want to document any type of limited compression if needed, especially if the patient has a pacemaker. You want to make sure that you do not come down on the pacemaker. On the CC view, it would not be a problem, but it's on the MLO view where you're going to run into a problem where you have to make sure that you're not compressing 40 pounds on someone's pacemaker. This may cause like a malfunction. You may cause like wires to be misaligned. So just make sure that you do take separate images. One thing I like to do is I like to take a full 3D image where I'm getting majority of the breast tissue in there, and then I take a 2D image, getting like proof that hey, the reason why this image is not the best or do not have a lot of compression on it, where the breast is probably like drooping down, I'm not getting a good IMF, is because this patient has a pacemaker. I can't compress what I need to compress. So you're throwing in that picture, kind of like what's on the screen, just saying, hey, this patient has a pacemaker. Um, so you don't want to compress the pacemaker and just get two separate images. Also, the pictures closer, well, the picture that's is on my left, but it may be on your right side of the screen, that's a pacemaker. And then the picture that's closer to me, which is on my right, that's a loop recorder. So if you don't know, a pacemaker is a small battery operated device that helps to regulate a slow or irregular heartbeat. Um, I often pay attention to pacemakers because I work in MRI, so I have to make sure that if a patient is getting an MRI scan, they can't come in a room unless their pacemaker has been cleared and someone is coming in to turn their pacemaker off for the scan. So I often pay attention to pacemakers because I have to know if whenever I work in MRI. Also, you have a defibrillator that will look similar to a pacemaker. This is a medical device used to treat irregular heart rhythms that can lead to a heart attack, um, which I always think pacemakers and defibrillators are pretty much the same thing. They are still like electronic devices. And then you also have your loop recorder, which is a small heart monitoring device that is implanted under the patient's skin in their chest area. Often you may see a scar on the patient's breast or chest area where they have had this implanted. Also, let me know in the comment box if you have seen someone with a pacemaker or a loop recorder. I mainly see pacemakers, but I hardly ever see loop recorders. Artifacts caused by patient devices as well. We have your chemo ports. I'm sure everyone probably have seen chemo ports on the mammogram image. If not, let me know in the comment box. But your chemo ports are used for patients who are undergoing chemotherapy treatments. You may have to document limited compression to avoid coming down on the chemo port. And often patients will, they will tell you, hey, make sure that you're not compressing too much, and you may even have to ask a patient if they have like any implants. Most of the time for your pacemakers and your chemo ports, you can see it bulging from under their skin, but it is good for them to tell you if they do have the devices, just in case you somehow get into a hurry and you do not check, which you should always check before you start your patient. Now we have other patient related artifacts. We have your jewelry, we have earrings. The earrings are normally not a problem if it's like very small. The only type of earrings that I will see that will cause a problem is if it's hanging or dangling down long, but I have not seen earrings like that in a while. Also, I see necklaces a lot. So I just normally have the patient just move it back, like twist it behind them instead of taking it off. Most of the time that works well. You have patients who may have gotten chest x-rays a lot. They normally just go ahead and put their necklace in their mouth. And I always say, no, for this you do not have to. So whenever I see a patient do that, I always just automatically just assume they may have recently had a chest x-ray or get them often for them to do that. And then also your hair. Believe it or not, I have seen curly hair and braids like show up on the mammogram image. So for the hair, they can just tie it up in a ponytail holder. or they can just like kind of like push it to the back or bring it to one side, just to avoid you having to take multiple images. But I know for a fact I've seen the curly hair and the braids, like it gets in the mammogram image, but it's beautiful. I always tell the patient, I'm sorry for messing up your hair. You can make a joke out of it. You can say, "Oh, your hair is so nice. Sorry for messing it up." And they normally laugh, just having like small talk in the middle of positioning patients. Now we have the technologist-related artifacts. This is due to improper positioning patients. This can cause tissue to be missed or not fully in the image or overlapping tissues. Pathology can be missed because of this, so make sure that you are positioning your patients properly. If you have been trained and you still in a stage where um, you're still unsure of how to do, let's say, an MLO view, or you're having problems with your implant patients, go get help. You can also attend like an online webinar where they show you different tricks on how to position. I also have videos on my page as well. You can also take like a positioning class to help with this. And inadequate compression. This results in an uneven density or patient motion that's seen on the image. Also, you can see blurriness on the image. I always like sometimes you'll have patients who just cannot tolerate enough compression, even if it's like the adequate amount. Like sometimes, you probably can barely get 9 or 10 pounds on them. Whenever those type of patients move and you have to keep repeating the pictures, they become frustrated. Just let them know, sorry, I'm not able to apply a lot of compression on your breast. This helps with the blurriness on the image. If I can apply a little bit more, maybe it'll help the image not come out with movement on it. So you can say something like that. Um, Also, we have inadequate removal of deodorant or powder, which can cause false calcifications to appear on the mammogram image, like under the axillary area. This do result in patients being called back if you do not catch it. So if you do not catch this and the radiology catches this, they will call the patient back. Patients may even need a biopsy to confirm if the area is a like malignancy or suspicious for breast cancer. So if a patient tell you that they do have the clear kind of deodorant on, still just save yourself some trouble, have them remove it. If they refuse to do so, you can document in the patient chart that you did offer them a wipe. Um, if you can say the patient declined the wipe, the patient refused to remove the deodorant, because this will cause technical repeats. You can even go so far as telling the patient they may call you back if they notice something. We're busy, so most of the time we do not have time to go and look on the internet to see if this clear kind of deodorant will cause um calcification like areas on the mammogram. So to avoid all of that, I just have them just please remove it. Most clinics have those free wipes anyway, and they also have the wipes where they can put the deodorant back on. And this is like a zoom picture where I zoomed in where you can see what I'm talking about of how the deodorant look like calcium specks seen on the mammogram. So just if you notice it, just have the patient just go back and wipe it off and then retake the image. If it's still there, you can get the radiologist to look. You can say, hey, this patient forgot deodorant on, and then I had them remove it. I'm still seeing something else. Do you think it's deodorant? Do you think it's calcifications? They're pretty cool about letting you know what it is and if you should retake the image. Now we have our equipment related artifacts. So we have our grid lines, which is caused from anti-scatter grid malfunction or misalignment. You also have your dead pixels or detector defects. I have seen this several times before. This will appear as black or white lines slash dots. I normally see this. So whenever you're taking your mammogram images and you see where your initials are, and you see your company name, your room number, I normally see those white specks or dots like on the outer side of the mammogram image, like those dead pixels, you still have to let your manager or supervisor know, because a service engineer, they will have to come and see like what's causing that, because if you're noticing this on the outside of the images, what if it's in the inside of the image? That can look like calcifications, micro calcifications in the patient's breast as well. Image ghosting or lag. This residual image is from a previous exposure. I don't believe I've seen like an image ghosting before, but the machine that I work on, sometimes it does lag. Also, you have your compression paddle marks. This is the edge of the paddle that may be visible if not properly aligned. You also have digital stitching artifacts. In digital breast tomosynthesis or full field mammography, you'll notice this. It occurs whenever images from different exposures are combined inaccurately. I don't recall seeing like a digital stitching artifact, but I'm sure I may or may not see it at some point in my career. Just let me know if you noticed this before. And then this is like an artifact that was seen during QC. Whenever my coworker was doing the QC, she noticed this artifact. Let me circle it so you can see. I highlighted that on my phone, but you can see inside of that yellow circle, that small white speck. So what happened, she let the manager know. The manager called like a service engineer to come and do some calibrations or their own QC. And once they did what they needed to do, this area got like away because they had to do the QC again. And the patients did have to reschedule. They either had to wait for the other mammography room to open up, because we had two rooms at this clinic that I worked in or worked at, or they had to reschedule if they didn't want to wait. Because, like I was saying on the previous slides, you can't just keep taking the image, because this may appear like calcifications in the patient's breast. So this is pretty much like a summary of all of our artifacts. So we have our artifact type, and then we have different artifacts. We have the appearance, the causes. So I'll just read through them real quickly. You can also pause the video and study this as well. So we have our motion blur. This appearance will look as blurred or double edges. It's caused by patient movement during the exposure. You have your skin line overlap. The appearance will be dense linear structures, and it's caused by improper skin positioning. Your deodorant artifact will appear as white specks resembling calcifications caused by metallic or powder residue. Even if a patient have told you, this can be 4 o'clock in the evening. If the patient have told you that they put deodorant on at 6 o'clock in the morning, still have them wipe it off. You just never know. You have your ghost image, which appears as like a faint image overlay. This is caused by a previous image not fully cleared. And then you have your detector dropout, which will appear as black or white lines or missing pixels. It's caused by dead pixels or detector failure. All right, so if you would like to, could you please let me know what state you're watching from or country, just in case someone may want to move to that area, or you may encourage someone to want to join mammography whenever they see that there are a lot of jobs available. So I have everyone watching from all over the U.S. I have California, I have Georgia, Arizona, have Houston, Florida, Maryland, and where else? Kentucky. I have Kentucky as well watching. So you can just leave a comment if you would like to. Just say I'm watching from, and you can say your state or country. All right, so that's it for this video. Thank you all for watching. Please feel free to give the video a thumbs up or comment below if you found the video helpful. Also, subscribe to my channel if you do not mind, and let me know if you would like more videos. Also, subscribe so that you do not miss any new videos. And these ladies that I have right here, this is my shout out board. These ladies passed their registry exam this year in 2025. Some passed in May of 2025. I've had one pass in June in 2025. A lot of the ladies that is closer to the left side of the screen, They have passed theirs in July of 2025. So this month we're at the end of July 2025. Um, you can also leave a comment, let me know when your test is scheduled for. I had a lot of people scheduled for July this month. So do you have your test coming up in August? Do you have it coming up in September? Please let me know in the comment box. I will be sure to attach my playlist so that you can just click on it, and also that video on how to chart in Mammo. Thank you all for watching, and I will see you all in the next video. Bye.